imagination, or does it seem that every new drug that comes on the market has cancer as a side effect? And now the World Health Organization says that in the next 20 years there's going to be a 57% increase in cancer. And they're saying that treatment really won't help. Of course, they're blaming it on tobacco and poor living, but ladies and gentlemen, this is the result of the Silent Weapons for Quiet Wars plan of depopulation. Club of Rome and the other insidious insiders who are working to reduce the population of this planet, and they're doing it as they do with all of their evil, right in plain sight. Listen to this commercial. It's right in your ear. Now, who would take any of these drugs?
Arms were made for hugging, hands for holding, feet kicking. Better things than the joint pain and swelling of moderate to severe rheumatoid arthritis. If you're trying to manage your RA, now may be the time to ask about Xeljanz. Xeljanz tofacitinib is a small pill for adults with moderate to severe RA for whom methotrexate did not work well. Xeljanz is an RA medicine that can enter cells and disrupt JAK pathways, thought to play a role in the inflammation that comes with RA. Xeljanz can lower your ability to fight infections, including tuberculosis. Serious, sometimes fatal infections and cancers have happened in patients taking Xeljanz. Don't start taking Xeljanz if you have any kind of infection unless okay with your doctor. Tears in the stomach or intestines, low blood cell counts, and higher liver tests and cholesterol levels have happened. Your doctor should perform blood tests, including certain liver tests, before you start and while you are taking Xeljanz. Tell your doctor if you have been to a region where certain fungal infections are common, and if you have had TB, hepatitis B or C, or are prone to infections. Tell your doctor about all the medicines you take, and if you are pregnant or plan to be. Taken twice daily, Xeljanz can reduce the joint pain and swelling of moderate to severe RA, even without methotrexate. Ask if Xeljanz is right for you.
I take pride in them. So when my moderate to severe chronic plaque psoriasis was also on display, I'd had it. I finally had a serious talk with my dermatologist. This time, he prescribed Humira, adalimumab. Humira helps to clear the surface of my skin by actually working inside my body. In clinical trials, most adults with moderate to severe plaque psoriasis saw 75% skin clearance. And the majority of people were clear or almost clear in just 4 months.
Humira can lower your ability to fight infections, including tuberculosis. Serious, sometimes fatal events such as infections, lymphoma, or other types of cancer have happened. Blood, liver, and nervous system problems, serious allergic reactions, and new or worsening heart failure have occurred. Before starting Humira, your doctor should test you for TB. Ask your doctor if you live in or have been to a region where certain fungal infections are common. Tell your doctor if you have had TB, hepatitis B, are prone to infections, or have symptoms such as fever, fatigue, cough, or sores. You should not start Humira if you have any kind of infection.
Make the most of every moment. Ask your dermatologist about Humira today. Clearer skin is possible.
So the undeniable truth is that the pharmaceutical industry and the medical mafia work very hard to keep their omerta, to keep their lie. There clearly is a predatory viewpoint, a predatory angle from the pharmaceutical industry. And the fact that Obamacare and everything that they speak of to reduce the cost to the American worker is done, everything is the opposite. It's a train wreck. It's a disgusting mess. But I don't have to go into that. You all know that. You just have to really face the truth if you have any doubt that it will be another nail in the coffin of freedom in this country, moving us closer to socialism and forced, basically, death panels, which they really will be. You really have to look only to the past to see the future, ladies and gentlemen. And we are heading towards what was a dangerous and deadly path in the past, and precariously close to that same route. I mean, why do all of these drugs cause side effects such as diabetes and cancer and other deadly and many deadly diseases, and that require more pharmaceutical drugs to be prescribed and more, getting everybody on the insurance program ensures that they'll get their money for these drugs that they're prescribing. And interestingly enough, for example, what about the psychotropic drugs that they give? Side effects to help people with depression, make them suicidal, to help them sleep, make them insane. What about the drugs given to children? Ritalin and Adderall and all of these other drugs. What about the cancer-causing hormone replacement therapies? What about Prilosec causing abnormal cell growth and stomach tumors in rats? What about the fact that many prescribed medicines have been shown to cause cancer in animals? And now the World Health Organization says that 57% increase in the next 20 years. Do you not see the connection? It's unbelievable, but Aldactone, a blood pressure medicine, that's usually sometimes prescribed for hormonal imbalances and facial hair growth in women, causes tumors. Another hugely controversial cancer connection has to do with the cholesterol-lowering statin drugs. In an article in the Journal of the American Medical Association, January 3rd, 1996, almost 20 years ago, warned that all members of the two most popular classes of lipid-lowering drugs, the fibrates and the statins, cause cancer in rodents, and in some cases at levels of animal exposure close to those prescribed to humans. Research in 2008 in the New England Journal of Medicine, September 25th, has cast a spotlight on Vytorin, a different kind of cholesterol drug, and investigators noted a higher incidence of cancer in subjects taking this medicine. An editorial in the journal noted that these findings leave both doctors and patients uncertain about the safety of the medication, and it's also said that dozens of other drugs that cause cancer in animals. The FDA ought to require studies that would clarify the risk rather than asking Americans simply to ignore the warnings of cancer, which is what they're doing, ladies and gentlemen, in their propaganda in all of these TV commercials and newsprint ads.
It follows you wherever you go. It's a cloud of depression. And although you've been on an antidepressant for at least 6 weeks, you're frustrated that your depressive symptoms are still with you. Seroquel XR, when added to an antidepressant, is approved for the treatment of major depressive disorder. For many, taking Seroquel XR with an antidepressant was proven more effective for treating unresolved symptoms of depression than an antidepressant alone. Call your doctor if you have unusual changes in mood, behavior, or thoughts of suicide. Antidepressants can increase these in children, teens, and young adults. Elderly dementia patients taking Seroquel XR have an increased risk of death. Call your doctor if you have fever, stiff muscles, and confusion, as these may be signs of a life-threatening reaction. Or if you have uncontrollable muscle movements, as these could become permanent. High blood sugar has been reported with Seroquel XR and medicines like it, and in extreme cases can lead to coma or death. Your doctor should check for cataracts. Other risks include decreases in white blood cells, which can be fatal, seizures, increased cholesterol, weight gain, dizziness on standing, drowsiness, impaired judgment, and trouble swallowing. Use caution before driving or operating machinery. For more help putting distance between you and your depression, ask your doctor about adding Seroquel XR today. Learn more at seroquelxr.com. If you can't afford your medication, AstraZeneca may be able to help.
When morning comes in the middle of the night, it affects your entire day. To get a good night's sleep, try 2-layer Ambient CR. The first layer dissolves quickly to help you fall asleep. And unlike other sleep aids, a second dissolves slowly to help you stay asleep. When taking Ambient CR, don't drive or operate machinery. Sleepwalking and eating or driving while not fully awake with memory loss for the event, as well as abnormal behaviors such as being more outgoing or aggressive than normal, confusion, agitation, and hallucinations may occur. Don't take it with alcohol as it may increase these behaviors. Allergic reactions such as shortness of breath, swelling of your tongue or throat may occur and in rare cases may be fatal. Side effects may include next-day drowsiness, dizziness, and headache. In patients with depression, worsening of depression, including risk of suicide, may occur. If you experience any of these behaviors or reactions, contact your doctor immediately. Wake up ready for your day. Ask your healthcare provider for 2-layer Ambien CR.
I was living with pain all over. The intense ache made it hard to do the things that I wanted. My doctor diagnosed it as fibromyalgia, thought to be the result of overactive nerves that cause chronic widespread pain. Lyrica is believed to calm these nerves. I learned Lyrica can provide significant relief from fibromyalgia pain, so now I can do more of the things I enjoy. Lyrica is not for everyone. It may cause serious allergic reactions or suicidal thoughts or actions. Tell your doctor right away if you have these, new or worsening depression, or unusual changes in mood or behavior, or swelling, trouble breathing, rash, hives, blisters, changes in eyesight including blurry vision, muscle pain with fever or tired feeling. Common side effects are dizziness, sleepiness, weight gain, and swelling of hands, legs, and feet. Don't drink alcohol while taking Lyrica. Don't drive or use machinery until you know how Lyrica affects you. Those who have had a drug or alcohol problem may be more likely to misuse Lyrica. With less pain, I'm feeling better with Lyrica. Ask your doctor if Lyrica is right for your fibromyalgia pain.
Here is the evidence. And then do the research. But don't believe me. Find your own truth. There is only one truth. Seek and you'll find it.
And this present window of opportunity during which a truly peaceful and interdependent world order might be built will not be here for too long.
When we are successful, and we will be, we have a real chance at this new world order, an order in which a credible United Nations can use its peacekeeping role to fulfill the promise and vision of the UN's founders.
There's the need for a new world order, but it has different characteristics in different parts of the world.
And the President outlined his vision of a new world order in which the US would participate fully.
We'll tell you
one rooted on four basic principles.
Non-proliferation and disarmament. None of it is true.
The promotion of peace and security. The preservation of our planet. And a global economy that advances opportunity for all people.
The affirmative task we have now is to actually create a new world order.
A world in which there is the very real prospect of a new world order.
It's about the future of Europe and a new world order.
After 1989, President Bush said, and it was a phrase that I often use myself, that we needed a new world order.
Your plan, you can keep your plan.
Watch Truth Talk News live, weeknights 7 p.m. Eastern Standard Time on truthbroadcastnetwork.com. Subscribe to Freedom First Films and Truth Talk News live on YouTube, where news the mainstream media ignores is the top story. Watch Truth Talk News live, weeknights 7 p.m. Eastern Standard Time on truthbroadcastnetwork.com. Subscribe to Freedom First Films and Truth Talk News live on YouTube, where news the mainstream media ignores is the top story.
Trexate did not work well. Xeljanz is an RA medicine that can enter cells and disrupt JAK pathways, thought to play a role in the inflammation that comes with RA. Xeljanz can lower your ability to fight infections, including tuberculosis. Serious, sometimes fatal infections and cancers have happened in patients taking Xeljanz.
Is it my imagination, or does it seem that every new drug that comes on the market has cancer as a side effect? And now the World Health Organization says that in the next 20 years there's going to be a 57% increase. Writers who are working to reduce the population of this planet, and they're doing it as they do with all of their evil, right in plain sight. Listen to this commercial. It's right in your... Now, who would take any of these drugs?
Arms were made for hugging. Hands for holding.
In cancer, and they're saying that treatment really won't help. Of course, they're blaming it on tobacco and poor living, but ladies and gentlemen, this is the result of the Silent Weapons for Quiet Wars plan of depopulation, Club of Rome, and the other insidious inside.
Feet kicking. Better things than the joint pain and swelling of moderate to severe rheumatoid arthritis. If you're trying to manage your RA, now may be the time to ask about Xeljanz. Xeljanz tofacitinib is a small pill for adults with moderate to severe RA for whom